Welcome back. Well, Australia is one step closer to rolling out a coronavirus vaccine. The federal government locking in a deal to distribute millions of doses across the country, with the first jabs on track for March.
Dr. Rob Grenfell from the science agency CSIRO joins us now from Melbourne. Dr. Rob, good to see you this morning. An early Christmas present here, but are you confident we'll be able to make it happen?
Yeah, look, Australia has a very good record in delivering vaccines to some of the harshest environments in the world. So I think today's announcement's actually very exciting, but it's one more step to get us closer to distributing vaccines across this country. And what a great move to actually bring in logistics companies with expertise to do so, because, as you know, minus 70 degrees for this Pfizer vaccine is pretty cold, and it's very important to get it right.
Yeah, well, DHL and Linfox, they have been the ones hired to transport the jab, while others will oversee the implementation. As you said, huge responsibility.
Well, look, they've been delivering many things across this country, and as I said, we have some of the hottest and harshest climates across here, and food, in one sense, also has to be delivered. But Australia has a long record of delivering vaccines to some of those central Australian places and monitoring it. So this will be very closely monitored, obviously, to make sure that there is consistency in the temperature in the transport time, so that it's actually out there on the road.
Dr. Rob, though, in the US and the UK, there's been an emergency push for the vaccine to go out already, just to try and stem the horrible cases they have over there and the height of how the COVID is going over there. We have yet to give them this vaccine a green light. Why is that taking so long?
Well, look, we're very fortunate in Australia to have probably the most stringent regulatory agency for drugs and vaccines in the world. Now, that's a good thing, because it means that they certainly won't release drugs and vaccines into the community for general release without the safety being fully understood. Now, we've also got a bit of time, because the death rates in the UK and Europe and the US are absolutely catastrophic. We're in a very fortunate position to take this meticulously through, and I have every faith that our Therapeutics Goods Association will in fact actually make the right decisions at the right time for the release of these vaccines.
Given Sydney's Northern Beaches outbreak, though, and no doubt we'll probably see more of them, do you think we should be looking at an emergency rollout?
Well, look, the urgency in places like the UK and the US, again, is because of the death rates. We're actually in a fortunate position that we're able to detect these infections rapidly and also bring them fairly smartly under control. Although the Sydney one, again, has given us great concern with the numbers, it's not as actually dispersed as the Melbourne one, which, of course, had multiple primary sources. And that's what made Melbourne a little different than Sydney.
What we've seen in America, though, is we've seen people like Dr. Anthony Fauci or the President-elect Joe Biden. These are people, senior citizens, getting the vaccine early. Is that something we should consider here for our most vulnerable? Because we know this has hit aged care the hardest.
Yeah, look, the government has set up an expert committee to look at who's first in line for vaccines, because, as we know, the first supply is only going to be 10 million, and also because of the difficulties of distributing the Pfizer vaccine in the first instance. Health workers are clearly the obvious choice, as are emergency workers. There's still a bit of a question as to whether we would immunise the aged themselves, because we haven't got as much clear information on how well this vaccine works in the aged populations. But any aged workers or health workers are obvious choices for, in fact, immunising. Reflect on the fact that 75% of the cases of coronavirus during the Melbourne outbreak were in health workers, so we do need to protect them.
Yeah, protect them first. Doctor, it really has been such a challenging year. We're almost at 2021. Can you just give us something positive to focus on? Can you see us beating this pandemic next year?
I'd like to be absolutely positive. I was just sort of reflecting. Last night I had dinner in the same restaurant I had at the exact time last year when I was hearing stories of sick Chinese doctors. And look what's happened over that 12 months. We are going to see continued sporadic outbreaks like we have recently in Sydney. We should have the faith in our public health services for actually alerting us of those and bringing them under control. But it means that our population needs to be alert and aware that it's possible this virus virus can break out at any time, anywhere across the country, and we need to get tested if we've got symptoms. On the other side of that, we'll see a gradual rollout of the vaccine, certainly at this stage touted from March, maybe earlier, where we'll have targeted vaccination programs, particularly for those most vulnerable and at risk. And for the rest of us, as more vaccines become available, I'd be positive to say that we'll be lining up towards the end of the year, the last quarter of the year, to have more mass immunisations to bring this under control and have a bit of positivity. So a tough year ahead of us in 2021, but we're up for this. We're in one of the luckiest places on the planet with such low rates of disease and certainly such a safe environment at the moment.
We are indeed. Dr. Rob Grenfell, have a safe Christmas. We'll speak to you very shortly. Thanks, mate.
You shall. Thanks.